One of the most important topics to me to talk about and share about with patients and in these research video blog posts is actually related to the importance of sperm health when it comes to fertility treatments, and even more so when it comes to the treatment of recurrent pregnancy loss. And I find it's very important to chat about this topic specifically because I don't think patients are talked to enough about this thing. And in fact, I often see patients where they come into my practice and no one's ever even mentioned it to them. So it's totally new and kind of mind blowing that we're so focused on sperm health when it comes to the treatment of recurrent pregnancy loss. Especially since 2018, we've been seeing like more and more research showing us how things like DNA fragmentation and the reproductive microbiome actually have a very important role in supporting healthy pregnancy, and how the health of the sperm can actually affect those things as well. So there's actually a very cool new research paper published in the Journal of BMC Immunology this year, so it's very new research, and they looked at something incredibly new. And this is, I think, one of the first research papers that's even looked into this topic on how this specific thing with sperm cells, and something that's actually quite manageable, may actually significantly affect the risk of miscarriage. So, just to break it down in an easy to understand way, there's a very crucial immune response that has to take place when fertilization or insemination occurs. This immune response actually triggers kind of a domino effect in changes in the immune system of the mother. And this change and shift in the immune system is very crucial and important to supporting a healthy pregnancy and maintaining a pregnancy. So what we've seen, and they highlighted in this new research, is that patients who have recurrent pregnancy loss, they actually seem to have very low signs of this immune reaction taking place. So they don't really, it doesn't seem like they're having that strong and normal immune response that's supposed to occur when fertilization or insemination takes place. And they're hypothesizing how the absence of this immune response may be a immune related defect that can affect the risk of miscarriage for a portion of couples that have recurrent pregnancy loss. So this probably does not answer, is this the cause for pregnancy loss for every patient? No, but there is probably a subset of the population that has recurrent pregnancy loss that specifically has recurrent pregnancy loss related to this immune defect. And so in order for this immune reaction to take place, what they found was if they just added one strain of a healthy probiotic to the sperm cells, it actually increased the expression of the specific antigen needed on the sperm cells for this immune reaction to take place. So they saw both things. They gave this probiotic to the male partner, and two things took place. The antigens on the sperm cell went up, which was a good thing, and this immune reaction that's supposed to occur during fertilization and insemination actually improved as well. So we saw markers increase that suggested that immune reaction was actually taking place again. And so this comes to highlight two things. One, potentially an advance in modifiable risk factors for risk of miscarriage, and two, the impact of the reproductive microbiome, which is a very big topic, very important topic that we've been seeing more research around since 2018, where I would say the study started coming out in more abundance and started being published. So what they found was that patients who have a history of recurrent pregnancy loss, the presence of other pathogenic or harmful bacteria in the reproductive tract could actually suppress this immune reaction that's supposed to occur. And the presence of healthy bacteria in the reproductive tract actually encourage the production of this immune reaction. So we're seeing this as very early research, and what we don't know and what the study didn't show was, does the increase in these specific antigens that they saw in the sperm cell and the increase in that immune marker in the female partner actually translate to more live births after a history of recurrent pregnancy loss? So they saw these improvements, but we kind of lacked that next step, which was, did those patients conceive and carry to term with a healthy live birth? So that would be like future research that we want to keep an eye out for and see how impactful this is. But it's adding to a growing body of research that shows how the reproductive microbiome of both partners can have a significant impact on potentially fertilization rates, pregnancy rates, and miscarriage risk as well. So it's really important to chat about this, especially because the vaginal dysbiosis, some studies have estimated, may affect upwards of 19% of patients trying to conceive. So if you're struggling to conceive or you have a history of recurrent pregnancy loss, it is absolutely crucial you speak with your licensed healthcare provider on whether you're at risk of reproductive dysbiosis and what the appropriate treatments or testing options would be for both partners, and not just the female partner, which is, I find, usually the focus for recurrent pregnancy loss. Unfortunately, it's very heavily focused on one partner, and that can reveal very important test results. We can see endocrine or hormonal issues, anatomical issues with the uterus. There can be other metabolic issues that increase the risk of miscarriage, but we're missing the proper in-depth conversation on how sperm health can equally affect the chance of a healthy pregnancy. And that's kind of what we want to try and bring to light with these research blog posts, and really sharing the new research and educational info directly with you.